Hi everybody, it's Dr. Ryan with another video review of one of the Step 1 Free 120 questions. In this video, we're going to look at Block 2, question number 20. So this question describes a 30-year-old woman who has 4 days of a painful rash over her body and mouth. 2 days before the development of the rash, she had flu-like symptoms, and 10 days ago, she took the sulfonamide antibiotic TMP-SMX for treatment of a UTI. She has a fever with a temperature of 102.2. Her skin shows brownish red macular exanthema with bullous lesions. Her epidermis can be easily removed with gentle pressure by the examiner, and then they tell you a biopsy was done and it shows keratinocyte necrosis throughout the epidermis. And so based on this information, what they want to know is which of the following is the most likely diagnosis. And they give us 5 answer choices, all of which are skin conditions. All right, guys, so this is a little bit of a tricky question because it really requires you to know your skin disorders. And dermatology isn't the highest yield topic, so a lot of students go into the Step 1 exam relatively weak in dermatology. So you should know that this is a fairly classic presentation of toxic epidermal necrolysis. And if you got this wrong, that's actually a great thing to have happen to you because you're always going to remember this presentation. So many elements of this are classic for TEN. So let me explain how I know this. So first of all, this woman was exposed to a classic trigger for toxic epidermal necrolysis or Stevens-Johnson syndrome, and that's the sulfonamide antibiotic TMP-SMX. After that, she developed flu-like symptoms, and TEN and Stevens-Johnson syndrome always begin with flu-like symptoms that come before the onset of the rash. Then she developed a painful rash over her body, but it also involves her mouth, and this is another huge clue. So toxic epidermal necrolysis and Stevens-Johnson syndromes, those are so-called mucocutaneous syndromes. They involve the skin, but they can also involve the mucous membranes of the mouth. So really all of these clinical features up here strongly point to the diagnosis being TEN, even before you get into any of the other details of this question. Another huge clue is that they tell you the epidermis is removed with gentle pressure. This is a description of Nikolsky sign. This is a skin finding anytime the epidermis separates from the underlying skin layers. And there are only 3 important disorders that cause Nikolsky sign. You need to burn these into your brain for Step 1. Those 3 disorders are pemphigus vulgaris, staph scalded skin syndrome, and toxic epidermal necrolysis. And unfortunately, all 3 of them are answer choices, so that doesn't give you the right answer. But once you recognize this is Nikolsky sign, then you know that one of these 3 choices here is going to be the right answer. And then they tell you a biopsy is done. It shows keratinocyte necrosis throughout the epidermis. This is also a classic finding of TEN, but you really don't need to know this to answer the question. All these features up here are so classic for TEN, and they don't fit with any of the other answer choices. So once again, burn this presentation into your mind, a very classic presentation of toxic epidermal necrolysis. Okay, let's talk about the wrong answers. And actually, let's start with answer choice C, pemphigus vulgaris. So this is not correct, even though this disorder does cause Nikolsky sign. So pemphigus vulgaris is an autoimmune condition. In a board question, it's going to be described in a middle-aged woman. They're never going to tell you that she took a sulfonamide prior to the onset of the condition because this isn't usually triggered by that, and that would be too confusing. And then pemphigus vulgaris is a blistering disorder. So the question is going to emphasize blisters, lots of blisters, flaccid bullae. Bullae are just big blisters. That's a classic finding in pemphigus. So none of this fits with an autoimmune blistering condition. Everything in this question is really pointing instead to a drug reaction from the sulfonamide. And then staph scalded skin syndrome can look something like this. It does have Nikolsky sign, but that's always going to be in a kid who had a staph infection, usually impetigo or some other staph infection, and then started to have this diffuse red rash with Nikolsky sign. So the presence of Nikolsky sign and the prior exposure to the sulfonamide really makes answer choice E the classic right answer. It doesn't really fit with any of these other choices. And then as to the other wrong answers, erythema multiforme does not cause Nikolsky sign, so this cannot be the correct answer. It presents with target lesions. They are always going to describe target lesions in a case of EM. And then answer choice B, linear IgA bullous dermatosis. I've never heard of this before. I had to look it up. It's another autoimmune type condition related to IgA antibodies. It's not triggered by a sulfonamide antibiotic, and it's not associated with Nikolsky sign. So take-home points from this question, in my opinion, are that derm questions are hard. Until you've done a derm clinic and you've seen lots of these things, these questions are always difficult to make the diagnosis just from the words in the question stem. So make some simple rules of thumb you can follow in your mind. The presence of Nikolsky sign in this question is a huge clue. And then know the classic presentation of TEN, exposure to a trigger like TMP-SMX, flu-like syndrome, and then skin and mucocutaneous lesions. And that concludes our video review of the Free 120 Block 2 question 20.